Hey guys, what's up? My name is Maritza, and I'm going to be helping Addie go over H influenzae with you guys. And I'm going to go ahead and start with the overview. Okay, so it was first found in 1890 during an outbreak of influenzae. Um, and Haemophilus does mean that it loves heme. It does require hemotin factor 10, which is a protein, iron, and NAD plus factor 5, which are both found in RBCs. And like I said, it is required in order for Haemophilus influenza to grow. Um, you could grow it in blood agar, but it's kind of gonna look like a satellite, and then it's gonna look like colonies on it. Um, so most of the time, what they do with that instead is do a chocolate agar, which is pretty much just like a blood agar but heated up. And then diseases caused by H. influenzae can affect many organ systems. Most types of diseases caused is type B, which is HIV, and then there's less common ones as well. Eddie's gonna go ahead and give you guys a little bit more information on that. There is a 3 to 6% HIV cases in children with which are fatal, and then there are patients older than 65 years old with invasive H. influenzae disease, which have higher case fatality rates than children. Up to 20% of patients who survive HIV, meningitis have permanent hearing loss or other long-term effects, um, mostly neurological. And then I went ahead and gave you guys a little more information, um, or an example of how much it would cost for medication and so on. And it's all going to be down here. And then it is a gram-negative bacteria. It is in capsule. It does have two morphologies, which one of them is encapsulated, which is the cocobacilli. And then there's the morphology that's not encapsulated, which is pleomorphic and are often like a thread. And I give you guys an example down here in case you guys want to take a look at that. So it is aerobic. The temperature that they love is 35 to 37 Celsius, and then their pH is 7.6. So yeah, so I'm gonna go ahead and let Eddie give you guys a little bit more information on it, and you guys have a good day.
Eddie Choi, and I will be talking about the pathogenesis of Haemophilus influenzae. Haemophilus influenzae interacts with the body in many different ways depending on what part of the body is infected. It can also spread from one infection that causes another, which we refer to as a secondary infection. Now we will talk about the portal of entry of Haemophilus influenzae. The portal of entry for Haemophilus influenzae is respiratory droplet transmission, as well as via contact with discharge from the nose and throat during the infectious periods. The portal of entry is most commonly through the nasopharynx. Now moving on to the endotoxins and exotoxins. Haemophilus influenzae produce endotoxins but show very little signs of producing any exotoxins. While the direct role of the endotoxins are still unclear, the lipo-oligosaccharides are believed to play a role in the inflammation cases, such as in otitis media. We will talk about what otitis media is later. Now we will talk about the adherence factors. Haemophilus influenzae has two major adherence factors, as well as biofilm formation capabilities to help it adhere to surfaces. There are two major factors. One of them is adhesins. Adhesins are cell surface components and appendages that help to facilitate adhesion. The second being pili. Pili are rod-like projections that cause agglutination and attach to epithelial cells. Agglutination just refers to the clumping of cells. Now we will talk about capsule/resistance. I grouped these two together because the capsule has a direct correlation on its resistance. Now, capsules are known to be a virulence factor because it greatly affects the invading cell's ability to cause disease by evading phagocytosis. Haemophilus influenzae has two major types: the HIB strain, which has a capsule, and the NTHI strain, which does not. The NT stands for non-typable Haemophilus influenzae, and the HIV just refers to the Haemophilus influenzae B strain. There are more on this later. Now, the secretion system. Haemophilus influenzae features a type 4 secretion system. There are 6 main secretion system types. Haemophilus influenzae is what is known as a type 4 secretion system, also known as the T4SS. Type 4 secretion systems facilitate horizontal gene transfer. There is a vertical and there's a horizontal gene transfer. Horizontal gene transfer refers to non-sexual gene transfer to different unrelated genomes. This type of secretion system contributes to the bacteria's plasticity, evolution of infectious pathogens, and dissemination of virulence such as antibiotic resistance. Now, I will be talking about the tissues and cell types affected by the Haemophilus influenzae type B strain. The initial infection of Haemophilus type B strain happens in the respiratory tract or the nasopharynx, where the bacteria colonize on a mucosal surface. As the infection progresses, it can make its way throughout the body, causing an assortment of different infections. These are the major infections caused by the type B strain, and I will be talking about some of the tissues that are affected by each of these infections. In pneumonia, the Haemophilus influenzae reaches the alveoli in the lungs as the infection progresses on from the nasopharynx and colonizes on the simple squamous epithelium of the alveoli. In the case of epiglottitis, epiglottitis is made of elastic cartilage that is covered in a mucous membrane and features a non-keratinized squamous epithelium in the anterior portion of the epiglottitis. In meningitis, as the infection progresses, Haemophilus influenzae reaches the bloodstream and gets disseminated into the central nervous system. The central nervous system is covered in a protective layer called the meninges that consists of 3 main parts: the dura, arachnoid, and pia mater. Here. For the tissues and cells affected by the non-typable Haemophilus influenzae, these are the major infections caused by the NT non-typable strain. In conjunctivitis, Haemophilus influenzae causes conjunctivitis when it makes contact with the conjunctiva. The conjunctiva is a thin membrane that covers the eye and lines the eyelids. Here. With sinusitis, the cells, tissues affected by the sinusitis are ciliated, pseudostratified squamous epithelium. Sinusitis can lead to other, sometimes more serious secondary infections. These are your major sinuses over here. In the case of otitis media, the infection affects the tympanic membrane located in the middle ear. This membrane is made of squamous epithelium. Here. Now, I will be talking about the clinical outcomes of both the encapsulated HIV strain and the unencapsulated NT-HIV strain. The encapsulated, I'll be talking about first. The encapsulated type of Haemophilus influenzae is commonly referred to as the HIV strain. The presence of a capsule in this strain is considered to be a major factor in its virulence. The capsule allows them to resist phagocytosis and lysis, and children are especially susceptible to HIV diseases. Notable HIV diseases, like I just talked about earlier, was pneumonia, epiglottitis, and meningitis. I will be describing some of these diseases. In pneumonia, the lung inflammation caused by bacteria or viral infections which fill the air sacs with pus and may become solid and possibly fatal. Some symptoms are cough, green, yellow, bloody mucus, shortness of breath, fatigue, sharp chest pain, vomiting, and nausea. In epiglottitis, the inflammation of the epiglottitis, the flap of the base of the tongue that keeps food from entering your trachea, this is also possibly fatal. Some of the symptoms include fever, severe throat pain, drooling, anxiety, and stridor. Meningitis. Meningitis is the inflammation of the protective membranes covering the brain and the spinal cord called the meninges. Some of the symptoms are fever, headache, stiff neck, nausea, vomiting, photophobia, and confusion. All of these infections I named here are very serious illnesses and can all possibly be very fatal. Now, to the uncapsulated, non-typable H. Haemophilus influenzae. The unencapsulated strain is referred to as a non-typable influenzae, NTHI. Unencapsulated is always less invasive compared to this encapsulated counterpart. This is because the capsule protects it from phagocytosis, so our natural immune cells will fight this, because without the capsule it will just undergo lysis or phagocytosis. Some notable invasive diseases of the non-typable HI is conjunctivitis, which is simply referred to as pink eye. Pink eye is the inflammation or the infection of the conjunctiva, the transparent membrane that lines the eyelid and covers the white part of the eyeball. Some symptoms are the swollen conjunctiva, excessive tearing, redness in the white of the eye, burning and itchy eye, yellow discharge from the eye, and blurred vision. This is it here. In otitis media is a group of inflammatory diseases of the middle ear. Some symptoms include crying, ear pain, neck pain, feelings of fullness in the ear, sleeplessness. It may lead to a respiratory infection and can be serious illness if untreated and if infection travels to nearby parts of the head, such as the brain. In 1930, two major types of Haemophilus influenzae were defined, and these two are the ones that we just talked about. I'll be talking about now the preventative and common treatments of a Haemophilus influenzae infection. Treatment. The usual treatment for diseases of the Haemophilus influenzae is taking antibiotics for 10 days for general pain management via medication or natural pain remedies. Antibiotics include ceftriaxone, ceftazidime, cefuroxime, and these antibiotics are primarily based on amoxicillin, azithromycin, and fluoroquinolones. Treatment for serious infection of Haemophilus influenzae include breathing support, medication to treat low blood pressure, and wound care for damaged skin caused by inflammation. The mode of action for these drugs. The Haemophilus influenzae drugs work by binding to transpeptidases. Transpeptidases are penicillin-binding proteins that catalyze the cross-linking between a peptidoglycan, which form the cell wall of bacteria. It works by inhibiting the bacterial cell wall synthesis. Haemophilus influenzae does have a vaccine. The vaccine for the HIV strain does exist, and the chances of an individual who was vaccinated to come down with the HIV infection is reduced by 90%. HIV vaccine does not work against the infections brought on by the NTHI strain because they're different strains. For example, infections such as conjunctivitis, which are brought on by the non-typable HI strain, is not preventable by this vaccine. But it is also proven to decrease cases of pneumonia, meningitis, epiglottitis, which are all cases of the B strain. Non-drug and treatment prevention. A non-drug treatment would include letting the milder infections run its course and let your immune system do the job. Prevention can include not touching your eyes, washing your hands, avoiding contact with someone with this infection, as well as, the most plausible treatment for this serious infection would be through drugs and antibiotics. These are our sources cited, and that was our presentation on Haemophilus influenzae. Thank you very much.
Hey guys, what's up? My name is Maritza, and I'm going to be helping Addie go over H. influenzae with you guys. And I'm going to go ahead and start with the overview. Okay, so it was first found in 1890 during an outbreak of influenzae. And Haemophilus just mean that it loves heme. It does require hemetin factor 10, which is a protein, iron, and NAD plus factor 5, which are both found in RBCs. And like I said, it is required in order for Haemophilus influenzae to grow. You could grow it in blood agar, but it's kind of gonna look like a satellite, and then it's gonna look like colonies on it. So most of the time, what they do with that instead is do a chocolate agar, which is pretty much just like a blood agar but warmed, heated up. And then diseases caused by H. influenzae can affect many organ systems. Most types of diseases caused is type B, which is HIV, and then there's less common ones as well. Eddie's gonna go ahead and give you guys a little bit more information on that. There is a 3 to 6% HIV cases in children with which are fatal, and then there are patients older than 65 years old with invasive H. influenzae disease which have higher case fatality rates than children. Up to 20% of patients who survive HIV, meningitis have permanent hearing loss or other long term effects, um, mostly neurological. And then I went ahead and gave you guys a little more information um, or an example of how much it would cost for medication and so on. And it's all going to be down here. And then it is a gram-negative bacteria. It is in capsule. It does have two morphologies, which one of them is encapsulated, which is the cocobacilli, and then there's the morphology that's not encapsulated, which is pleomorphic and are often like a thread. And I give you guys an example down here in case you guys want to take a look at that. Um, so it is aerobic. The temperature that they love is 35 to 37 Celsius, and then their pH is 7.6. So yeah, so I'm gonna go ahead and let Eddie give you guys a little bit more information on it, and you guys have a good day.